Leqembi. On the 6th of January 2023, the U.S. Food and Drug Administration approved Leqembi, lecanemab-irmb, via the accelerated approval pathway for the treatment of Alzheimer's disease. Leqembi is the second of a new category of medications approved for Alzheimer's disease that target the fundamental pathophysiology of the disease. These medications represent an important advancement in the ongoing fight to effectively treat Alzheimer's disease. Leqembi is an amyloid beta-directed antibody indicated for the treatment of Alzheimer's disease. Treatment with lecanemab should be initiated in patients with mild cognitive impairment or mild dementia stage of disease, the population in which treatment was initiated in clinical trials. There are no safety or effectiveness data on initiating treatment at earlier or later stages of the disease than were studied. This indication is approved under accelerated approval based on reduction in amyloid beta plaques observed in patients treated with lecanemab. Continued approval for this indication may be contingent upon verification of clinical benefit in a confirmatory trial. In patients who develop intracerebral hemorrhage greater than 1 cm in diameter during treatment with lecanemab, suspend dosing until MRI demonstrates radiographic stabilization and symptoms, if present, resolve. Use clinical judgment in considering whether to continue treatment after radiographic stabilization and resolution of symptoms or permanently discontinue Leqembi. Dosage and administration. Confirm the presence of amyloid beta pathology prior to initiating treatment. The recommended dosage is 10 mg per kilogram that must be diluted then administered as an intravenous infusion over approximately 1 hour, once every 2 weeks. Obtain a recent, within 1 year, brain MRI prior to initiating treatment to evaluate for pre-existing amyloid-related imaging abnormalities, ARIA. Obtain an MRI prior to the 5th, 7th, and 14th infusions. If radiographically observed ARIA occurs, treatment recommendations are based on type, severity, and presence of symptoms. Dilution in 250 ml of 0.9% sodium chloride injection, USP, is required prior to administration. Administer as an intravenous infusion over approximately 1 hour via a terminal low-protein binding 0.2 micron inline filter. Dosage forms and strengths. Injection. 500 mg, 5 ml, 100 mg per milliliter, solution in a single-dose vial is given. 200 mg, 2 ml, 100 mg per milliliter, solution in a single-dose vial is given. Warnings and precautions. Amyloid-related imaging abnormalities, ARIA. Enhanced clinical vigilance for ARIA is recommended during the first 14 weeks of treatment with lecanemab. Risk of ARIA, including symptomatic ARIA, was increased in apolipoprotein E-epsilon-4 homozygotes compared to heterozygotes and non-carriers. If a patient experiences symptoms suggestive of ARIA, clinical evaluation should be performed, including MRI scanning if indicated. Infusion-related reactions. The infusion rate may be reduced, or the infusion may be discontinued, and appropriate therapy administered as clinically indicated. Consider pre-medication at subsequent dosing with antihistamines, non-steroidal anti-inflammatory drugs, or corticosteroids. Adverse reactions. Most common adverse reactions, at approximately 10% and higher incidence compared to placebo, infusion-related reactions, headache, and ARIA edema. Dilution instructions. Prior to administration, lecanemab must be diluted in 250 ml of 0.9% sodium chloride injection, USP. Use aseptic technique when preparing the lecanemab diluted solution for intravenous infusion. Calculate the dose, mg, the total volume, ml, of lecanemab solution required, and the number of vials needed based on the patient's actual body weight and the recommended dose of 10 mg per kilogram. Each vial contains lecanemab concentration of 100 mg per milliliter. Parenteral drug products should be inspected visually for particulate matter and discoloration prior to administration, whenever solution and container permit. Check that the lecanemab solution is clear to opalescent and colorless to pale yellow. Do not use if opaque particles, discoloration, or other foreign particles are present. Remove the flip-off cap from the vial. Insert the sterile syringe needle into the vial through the center of the rubber stopper. Withdraw the required volume of leqembi from the vials and add to an infusion bag containing 250 milliliters of 0.9% sodium chloride injection, USP. Each vial is for one-time use only. Discard any unused portion. Gently invert the infusion bag containing the leqembi diluted solution to mix completely. Do not shake. After dilution, immediate use is recommended. See description, 11. If not administered immediately, store leqembi refrigerated at 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit, for up to 4 hours, or at room temperature up to 30 degrees Celsius, 86 degrees Fahrenheit, for up to 4 hours. Do not freeze. Administration instructions. Visually inspect the leqembi diluted solution for particles or discoloration prior to administration. Do not use if it is discolored or opaque or foreign particles are seen. Prior to infusion, allow the leqembi diluted solution to warm to room temperature. Infuse the entire volume of the Leqembi diluted solution intravenously over approximately 1 hour through an intravenous line containing a terminal low-protein binding 0.2 micron inline filter. Flush infusion line to ensure all leqembi is administered. Monitor for any signs or symptoms of an infusion-related reaction. The infusion rate may be reduced, or the infusion may be discontinued, and appropriate therapy administered as clinically indicated. Consider pre-medication at subsequent dosing with antihistamines, non-steroidal anti-inflammatory drugs, or corticosteroids. See warnings and precautions. Clinical trials experience. Because clinical trials are conducted under widely varying conditions, adverse reaction rates observed in the clinical trials of a drug cannot be directly compared to rates in the clinical trials of another drug and may not reflect the rates observed in practice. The safety of leqembi has been evaluated in 763 patients who received at least 1 dose of Leqembi. In Study 1 in patients with Alzheimer's disease, 161 patients received Leqembi 10 mg per kilogram every 2 weeks. See Clinical Studies, 14. Of these 161 patients, 44% were female, 93% were white, 6% were of Hispanic or Latino ethnicity, 4% were Asian, and 2% were Black. The mean age at study entry was 73 years, range from 51 to 88 years. In the combined double-blind, placebo-controlled period and long-term extension period of Study 1, 237 patients received Leqembi for at least 6 months, 217 patients for at least 12 months, and 186 patients for 18 months.